a Pharmaceutics 1 class of D Pharmacy, subject code 1.1T, Unit 5. In this class, we are going to discuss gaseous sterilization. As the name indicates, gaseous sterilization, this is a sterilization which is done with a chemical that is in its gaseous state. Among the other methods, other different gaseous sterilization method, formaldehyde sterilization by formaldehyde was one of the oldest method, and it was very commonly used previously. Apart from formaldehyde, the other gaseous sterilization methods are sterilization by ethylene oxide and sterilization by beta propiolactone. Nowadays, the sterilization by formaldehyde is generally uh, overtaken by or generally replaced by sterilization by ethylene oxide. However, we are going to study all the three methods by formaldehyde, by beta propiolactone, and by ethylene oxide. So first of all, sterilization by formaldehyde. Formaldehyde is basically an alkalizing agent which was used uh, to sterilize some special chambers in hospitals and to sterilize catheters, syringes, and other thermolabile substances which degrade in presence of heat. So those things can be sterilized by using this formaldehyde gas. However, nowadays the use of formaldehyde has been restricted for sterilization purpose, and it is only used in certain cases like in the fumigation of empty rooms and after infectious diseases. There many disadvantages of formaldehyde has been found over ethylene oxide, and the disadvantages, some of the disadvantages I have given over here. uh, First one is, in compared to ethylene oxide, formaldehyde is having weak penetration power, which is a major drawback of formaldehyde. The next thing is, we have to maintain a higher concentration of formaldehyde in atmosphere, and which is very difficult to maintain. The next is, it needs a higher humidity for efficient sterilization of any substance, which is again is a difficult thing to have to maintain everywhere. And formaldehyde, it readily inactivated by proteins and other organic substances, which is a disadvantage. And if formaldehyde is absorbed, uh, the gas is absorbed anywhere in the surface of any substance, it is very difficult to remove this gas, formaldehyde gas, adsorbed gas. So, which is again a drawback of formaldehyde. And formaldehyde is irritating to our respiratory tract, which is also a major drawback of the formaldehyde. Next, we are going to discuss the sterilization by beta propiolactone. Beta propiolactone is one of the latest sterilizing agent, and it is having a higher boiling point, which is around 160 degrees centigrade. So it is non-flammable. One of its major characteristics is it is non-flammable in nature. So we can use these things effectively for the purpose of sterilization, even in presence of heat. If we compare beta propiolactone with ethylene oxide, we have seen that beta propiolactone is having less penetration power in compared to ethylene oxide, and it is majorly being used in for sterilizing operation theater and aseptic room, etc. The specific amount that is needed per liter of space at room temperature, which is around 25 degrees centigrade, is around 2 to 4 mg of beta propiolactone is required to sterilize uh, per liter of space at room temperature. There are some major disadvantage of beta propiolactone. One of them is it causes irritation, blister, and it burns in skin. So when it is comes in contact with skin, it can form blisters, it burns the skin, and it causes major irritation, which is a major drawback, major disadvantage of using beta propiolactone. The other major disadvantage is it is carcinogenic in nature. That means it can cause cancer to the patients or to the person they are coming in direct contact with. So that is another major disadvantage of beta propiolactone. So that's all for today's class. In my next class, I'm going to discuss the other gaseous sterilization method, which is sterilization by ethylene oxide. Thank you.